keep looking at my nose. And I'm going to shine the light from side to side, from the outer part of your eye to the inner. Hi. Before we get into this video, I'd like to thank all my Patreon members for their continued support. If you want to follow me on my other platforms, my link is in the description below. Now, let's get into the video. Hi there. Come on in and take a seat. Make yourself comfortable. Today, I'm going to be doing a very detailed cranial nerve exam on you, and this is going to involve a few simple checks of your vision, your eye movements, your facial sensations, your hearing and your facial muscles, tongue movements, shoulders, and a few other small tests, and nothing should be too painful. Some of the tests may feel a little unusual, but I'll explain everything before I do it. I'm just going to be looking at how the nerves in your head and face are responding, so I'll be asking you to follow my finger, watch a light, and tell me what you can feel, listen to a few sounds, and copy a few facial movements. All I need you to do is to relax, sit still, and follow my instructions. And if anything feels uncomfortable at any point, you can let me know. Before we start, I am going to take a quick look at you, and I'm just going to look at your face at rest, your eye position, your facial symmetry, your posture, and just how relaxed your expression is. Good. Everything looks calm and even so far. I'm going to put some gloves on now. Okay. We'll start with cranial nerve 1, which is your sense of smell. For this part, I'm going to test each nostril separately. I'll ask you to close your eyes, then I'll gently block one side of your nose and hold a scent near to the other side. You don't need to breathe in too hard, just a gentle sniff. Then you tell me what you smell. All right, close your eyes for me, please. I'm going to start on your right side. So block your left nostril for me. Thank you. Now, can you take just a small sniff? Good. What do you smell? Perfect. Now we'll try the other side. So I'd like you to block your right nostril for me and leave your left one open. Small sniff now. Good. What do you smell there? Excellent. Now, one more scent, just to compare. Eyes still closed, right side first. Good. And sniff. Good. Close that right nostril, now the left side. Sniff. Perfect. You can open your eyes now. Your sense of smell seems to be even on both sides. So we're now going to move on to your vision now. So for this section check, I'll be checking your visual acuity, your visual fields, and how your pupils respond to light. So first I'm going to ask you to just look straight ahead and try to keep your eyes on my nose. Good. I'm going to hold up fingers in different areas of your vision, and I'd like for you to tell me how many fingers you see. But keep looking right at my nose as you do that. Ready? How many fingers do you see? Keep looking at my nose. Good. How many? Good. How many? Good. How many? Keep looking at my nose as you do this. Perfect. Now I'm going to bring my fingers in from the sides lights. Tell me when you first see them, okay? Good. But remember, keep looking at my nose. Again, tell me when you can first see them. Look at my nose. Good, good. 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 Keep looking at my nose as you're doing this. Good. That's good. Excellent. Now, I'm going to check your pupils with a light. The light, it may be bright, so just try to keep looking straight ahead past me. You don't need to look directly into the light, though. All right. Just look at my nose. Keep looking at my nose. And I'm going to shine the light from side to side, from the outer part of your eye to the inner. Good. And again, other side. Keep looking at my nose. Good. Good. I'm going to bring the light up from the top down. Keep looking at my nose. Keep looking at my nose. Good. Next eye, top down. Keep looking at my nose. That's good. And from the bottom up. Keep looking. Keep looking at my nose. That's good. Good. Excellent. Your pupils are responding evenly. So now we'll check your eye movements. This part checks the nerves that control eye movement. So what I'm going to be doing is I'm going to be asking you to follow my finger without moving your head. Only move your eyes. Try your best to keep your chin still. All right, good. Now follow my finger. Keep following my finger. Good. Follow that finger. Good. Keep following my finger. Make sure your head does stay straight. Good. 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 All right. Excellent. Now I'm going to make an H shape. So just follow the tip of my finger as I do that. Good. Good. I'll do it again. Left to bottom, up, center, right, up, down, up, and back to center. Very good. I'm watching for smooth movement, equal tracking of your eyes and whether there is any jumping or discomfort. Everything is looking smooth so far, though. Now, I'm going to bring my finger slowly towards your nose. Keep watching it as it comes closer. Focus right here. Good. Keep watching. Good. And relax. Good. We'll do that one more time. Watch the tip of my finger as it comes in slowly to your nose. Good. And relax. Great. Now I'm going to switch to a light. What I'd like for you to do is to keep your head still and follow the light with your eyes. Now, follow this light. Just follow it for me. Excellent. Keep following that light. Good. And again. Good. And again. Good. Now in a circular motion, follow that light. Good, good. And the other direction, follow that light. Good. Now I'm going to move the light a little closer closer and farther away from you, and I'd like you to keep your eyes focused on it as I do so. So focus on it as I come in. Good, and out. Excellent. Your eye movements look coordinated, so now we're going to check your facial sensations. So what this cranial nerve does is it helps with facial sensation and jaw movement. I'm going to touch different areas of your face with a soft bristle and then a non-soft side. You tell me if it feels the same on both sides. I'll use the soft side first. So this is just a soft touch, and I'll compare it to your forehead and your cheeks and your jawlines. Good. How did that feel? Great. So close your eyes for me. First, I'm going to do your forehead again. Do you feel that? Good. And that. Do you feel that? Good. Same on both sides. Good. Now your cheeks. Keep your eyes closed. Good. Good. Same. Good. Now your jawline. That side. And that side. Same. Excellent. Now I'm going to do a slightly sharper sensation. Not painful, just a little bit more defined. So no bristles on this side. So we're going to do the same thing that I just did. So you tell me if it feels the same on side to side. I'll start with your forehead, up here, and here. Same? Good. Let's do your cheeks. Same? Good. Let's do your jawline now. And this side. Same? Good. You can open your eyes now. Now, I'm going to check your jaw muscles. So, clench your teeth for me. Just clench your teeth there. Good. Clench, bite down. Good. Hold that. Just as I check. Good. And relax. Open your mouth slightly, just like this. I'm going to apply a little bit of resistance. Try to keep your jaw open as I try and close it. Good. Good. And relax. Now, move your jaw side to side, like that. Good. Great. Any discomfort? Good. So, for me, everything feels even. Now we'll check the facial nerve on you. This part checks your facial expression muscles, so I'm going to ask you to copy a few movements that I'm going to do. So first, raise your eyebrows. Good. Just follow what I'm doing. Good. Hold that though. Good. And relax. Now, wrinkle your forehead for me. Good. Now, close your eyes tightly, like you're trying to not let me open them. Don't let me open them. I'm just going to test the strength of them. Okay, good. Keep them closed. Don't let me open them. Fight. Good. And relax. Now, smile for me. Nice and big. Good. Keep that big smile there. Good. And relax. Now, puff your cheeks out for me. Puff those out. Good. Hold the air in. Great. Good. And relax. Now, show me your teeth. Big smile. Good. Now, purse your lips like this. Good. Perfect. Great. Everything is moving evenly on both sides. So now we'll move to hearing. So for the hearing part, I'm going to be checking your hearing on each side, your left and your right. So first I'll make a soft sound in one ear, then the other. And what I'll be asking for is you to tell me which side you hear it on. So you're going to keep your eyes closed for this part. So close your eyes. Which side? Good. Which side? Good. Now I'm going to make the sound softer. Which side? Good. Which side? Good. Now I'm going to whisper a word or a number near one ear. I'd like for you to repeat it back to me. 99. 7. Good. Good. Blue. Good. 42. Good. Window. Excellent. And the last one. Stairs. Great. Now I'm going to use this tuning fork. I'm going to be using this tuning fork. I'd like for you to tell me when it stops, when you stop hearing the sound. You can hear that sound, correct? Good, I'm going to hold it near your right ear. You tell me when you can't hear it. Good. Again and again. You can hear it? Tell me when you can't. Good. I'm going to now place it gently in the middle of your forehead. Tell me if the sound feels louder on the left side, in the center, or equal. Sounds equal. Good. You can open your eyes now. Hearing seems balanced. So now we'll check the nerves that help with swallowing, voice, and palate movement. So for this part, I'm going to listen to your voice, check your swallow, and look briefly at the back of your throat. So first things first is, can you just say ah for me? Good. And a little longer. Good. Your voice sounds clear. No hoarseness, no strain. Now, swallow for me like this. Good, good. One more swallow. Good. Now I'm going to use a tongue depressor. So I'd like for you to open your mouth and say ah for me. Open for me. Good, good. Now say ah again. Nice and loud. Good. I'm looking at the palate. It's rising evenly. The uvula staying centered, the piece in the back of your throat, and the rest of your throat moves symmetrically. So that's very good. You can close your mouth and relax now. Now, I'm going to ask you to cough once for me. Go ahead. Now, can you say ka ka ka? Good, good. Everything there looks normal for the exam, from what I've seen here. So now we'll check your shoulder and your neck strength. This nerve helps control your shoulders and some of your actual neck movements. So first things first is I'd like you to shrug both shoulders up towards your ears, like this. Good. Hold them there now. And I'm going to press gently down on them. I'd like for you to resist. Resist. Keep resisting. Resist. Good. You can relax. Now, turn your head to the right. Good. I'm going to place my hand here on your face, and I'm going to try and turn your hand gently. So, turn your head. Good. And resist as I pull back. Try not to let me turn your head. Good. Again, the left side. Good. And I'm going to push, push, push. Pushing into your hand, my hand. Hold it. Good, good. Now, look straight ahead. Shoulder and neck strength are even on both sides, I'd say. So now we're going to check the final cranial nerve, which is controls of the tongue movement. For this part, I'm going to ask you to move your tongue in a few directions for me. So firstly, open your mouth for me. Good. Stick your tongue out, like that. Good, hold it there. I'm checking if it comes out straight. Now, move your tongue to the left. Good, and to the right now. Good, and now up and down. Good, good. Now move it side to side a little faster. Perfect. Now press your tongue into your cheek on this side, like that. Good, and the other side. Good, into that side again. I'm going to push gently against your cheek from the outside. Just hold it there for me like that. Good, good, hold. All right, now the other side. Good. Pushing your tongue into your cheek. Good, good, good. Hold. Good. And relax. Everything looks coordinated. All right, so that completes the cranial nerve portion of the exam. I'm just going to do one final overall check, though. Nothing too difficult here, so just follow a couple simple instructions here. So, look straight ahead at me. Good. Now, look at my finger. Follow it slowly. That's good. Follow it slowly. Great. Now, keep looking at my nose. I'm going to touch both sides of your face one more time as you are looking at my nose. We will just top here, forehead. You can feel that? Good. And your cheeks. You can feel that? Good. And your jaw. You can feel that? Good. Now smile one more time for me. Nice and big. Great. Raise your eyebrows. Nice and high. Nice and high. Close your eyes tightly for me now. Close them tight. Squeeze. Good. And relax. Now shrug your shoulders for me. Good. And relax. Perfect. Everything today looked balanced and symmetrical. Your eye movements were very smooth. Your pupils responded well to the light, and your facial sensations were even. Your hearing checks were balanced, and your facial movements were strong. Your shoulder, neck, and tongue movements were well coordinated as well. So from this exam, everything looks good. I'm just going to make a couple notes in my booklet. Good. You did really well today, by the way. You did really well. That is the end of the exam. You can relax now. Take your time, though, before standing up. Thank you for letting me do such a detailed check on you today, and you're all done.